Thank you for calling Equitas Health. How can I help you?
In the heart of the short north.
So Equitas Health is Ohio's largest LGBTQ+ and HIV/AIDS service organization.
Hey, I can take it.
One of two Equitas healthcare centers in Columbus that serve about 17,000 patients per year.
$4.40.
In the waiting room.
Oh, cool. Awesome.
Ohio State University student Evelyn Evergreen, who relied on Medicaid up until last year.
What qualified you for Medicaid?
Mostly just being not making enough money.
Evelyn qualified for benefits through the Ohio Department of Medicaid due to her annual earnings of $15,000. She was one of 750,000 Ohioans that made up an expansion group due to their poverty status.
We're talking about more than a quarter of the state is enrolled in Medicaid.
Yeah.
Is that a lot?
Yeah, I mean that's a substantial number.
But now Ohio is talking about cutting that expansion group off Medicaid as the U.S. House of Representatives and Senate remain at odds of where to cut federal spending. Ohio receives 65 cents from the government for every state dollar spent on Medicaid. With the House plan, fears of more than $30 billion designated for Ohio could go away.
So if your patients don't receive that medication, what could happen?
Making sure you're able to take your medication is one of those key things.
At the State House, more concern.
So it's really a scary world that I live in right now because in one swipe of a pen, either on the federal level or the state level, I know that what I used to survive in my life and the reason I can be here today is because of Medicaid.
As more healthcare companies warn of rising costs or hospital closings.
Everything gets paid for. It's a matter of who pays for it.
Evelyn knows what it's like to live without insurance and with ADHD.
And so I grew up knowing that I had this disability, but also not being treated for it.
She shows me how she's preparing.
You are creating a stockpile because you are worried about Medicaid cuts?
For what could lie ahead.
Stockpiling over-the-counter medications to be prepared.
On your side, I'm investigator Lisa Rontola.